So at Yorkshire Concussion Clinic, we provide high quality medical care in the field of sport-related concussion. So our team's got doctors, physios and researchers, all with specialist interest in concussion. We carry out baseline testing, medical assessment, consultations and rehab assessments as well. As well as this, we also do research and education on top.
So baseline testing adds vital information to the effective management of concussion. It does this by giving us an insight into an athlete's individualised pre-injury functional ability. The better understanding we have of this and of an athlete themselves, the more accurate our rehabilitation and return to play decisions can be. Having access to these test scores post-injury can provide us with a personalised, objective data that can be used to make a more informed and safer return to play decision. At the Yorkshire Concussion Clinic, we use a research-backed multimodal assessment battery in order to give us a comprehensive picture of an individual. So the testing we provide at the clinic can include some or all of the following. So neurocognitive function testing, neck function and strength, heart rate response to exercise, mental health screening, vestibular-ocular function and balance.
So at Yorkshire Concussion Clinic, we provide medical consultations, assessments and advice to both professional and amateur clubs and players, but this can also include schools and colleges. This can be for first-time concussions as well as those needing kind of more specialist services such as second-time concussions in professional athletes. So what does a consultation involve? Well, it involves taking a detailed history, examining the player, and then further exercise-related testing. And then following that, we can really support the clubs in getting this individual back to play.
So when it comes to the rehab of concussion injuries, it's really important we're objective with our findings and we find effective management through that. So we look at all our testing findings, so whether that's neck strength, vestibular-ocular function, and then through that we can develop an individualised specific rehabilitation plan for the player or the person in question. So that might mean they've got a deficit in vestibular-ocular function that we need to specifically target and work with, or they might have a slight weakness in neck strength, which might give them a potential increased risk of following and subsequent concussions.
So working with a range of university partners, our group is heavily involved in education and research. So many members of our team teach sport-related concussion courses. We're involved in teaching diagnosis, assessment and rehab for concussion. So our members of our team carry out doctoral and postdoctoral research and supervise MSc and PhD students as well. So our research and education is really important to us because this helps to ensure that our concussion work is up to date and reflects the latest evidence and research.